And welcome to the Dr. Bob Show. Are you putting too much food in your tummy? Well, most of us do in the United States, and we suffer the consequences, weight gain. There's an epidemic of obesity in the United States, and it leads to other problems. How can we handle that? What if our stomach felt full when we sat down to eat? There's a new form of treatment worldwide accepted called balloon therapy. My guest is Dr. Gene Overholt, board-certified stomach specialist. He'll be talking to us about the pros and cons of balloon therapy. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about how do I know if my immune system is working? I'm getting infections all the time. And Sjogren syndrome, dry eyes, dry mouth, what causes it and what can we do about it? A lot of information for you. You want to stay tuned. We're talking with Dr. Gene Overholt, board-certified gastroenterologist, and we're going to be talking about balloon therapy. Gene, welcome to the Dr. Bob Show.
Thank you, Bob.
Tell me about the balloon therapy for weight loss. Well, what is it?
Well, it's a balloon that's inserted into the stomach with a scope, but it's important to understand it's only one part of a comprehensive program that is to encourage patients to change their lifestyle and their attitudes toward eating and exercise. It's an important part, but it's only one of three parts.
So the three parts would be nutrition, exercise, and
the balloon, and you throw in there with a mix of communication, and communication between us and the patient and the relationship that's developed and the accountability that's developed between us and the patient is very important in all this.
So we've got a contract, patient and physician type situation where the patient is responsible and the physician is responsible for the end product, which is weight loss. Is that right?
Absolutely correct. And we hold them accountable and we expect them to hold us accountable for success.
Now, how much weight loss are we talking about in general?
30 to 50 pounds is anticipated with this balloon. And if we can have the patient with us for a full year, we want more.
So 30, 40, 50 pounds or more. Tell me about the balloon. How do you put it down? What does it do? How do you prep the patient? It sounds pretty exciting to me.
It is exciting. It's a brand new approach in the treatment of obesity, and it's going to be successful providing you have that comprehensive program. The balloon is wrapped and packaged into something about the size of your finger, which is placed on the end of a small tube and can be put down into the stomach during a scope. And once it's there and you're sure about the position, you can inflate it with 650 cc's of fluid so that when it's in the stomach, it looks like this, which is quite large.
So when you put it down, it's small, but you put fluid into it, it balloons it up. Does that float around in the stomach, or do you tie it down to the stomach?
It's a round ball, and it's free floating. It's not tied to anywhere, so if the patient lies on their right, or on their left, it can move a little with them, and they will feel that, particularly the first 2 or 3 weeks, and then they get used to it.
When you sit down and eat food, and that's in your stomach, does it keep you from eating so much?
The principal way this works is that it fills up the stomach so that patients will eat about a third of what they usually eat and feel full already. So it's the fullness and the sensation of what we call satiety that encourages the weight loss.
So do they eat 3 meals a day? Do they snack?
Generally, we encourage them to eat 3 regular meals a day.
Okay.
And we monitor that and their calorie intake, and we monitor their activity.
So you put down this balloon through the mouth, through the throat with the scope, endoscope? Is that the way it's put down?
Yes. The patient is sedated. They don't feel anything. They don't remember. We go down with the scope to take a look. If everything looks good, then we put down another small tube with the balloon on the end of it, inflate it, detach it, and then pull everything out. Leave the balloon in place. It's quite remarkable.
How long do you keep the balloon in there?
6 months. The FDA will allow us to keep this in for 6 months. The major weight loss is in the first month or 2. Then it kind of tapers off. We take it out at 6 months, and we watch the patient intensely to be sure that they are adhering to diet and exercise.
Now, does this balloon stretch the stomach so that when you take it out, they've got a stretched stomach that wants to receive more food?
No, the stomach ordinarily could handle 2 or 3 of these balloons in it. So when it's empty, it will compress into something not much bigger than my hand, but when it's full, it's big like this. The balloon does nothing permanent to change the anatomy or the function of the stomach.
So why does the balloon stay in the stomach? Why doesn't it come up into the esophagus? And why doesn't it go through the duodenum into the small bowel?
It's too big. It's too big to come up, and it's too big to go out.
So it stays around and floats.
Stays there.
Until you take it out. Now, how do you take it out?
You can go down with a scope, take a look around, be sure the stomach is empty of fluid, and then you can take a small catheter and stick it through the balloon and suction out the fluid. Once it's collapsed, you can grab the balloon and pull everything out. It's a very smooth operation.
And tell me about the comprehensive program. It's very exciting, and it looks to me like, you know, you've got everything lined up about putting the balloon down in the stomach, filling it up, making it where you're full easy. So how does the patient exercise, and how do you get them to be accountable for that? And how do you handle nutrition?
Well, you put your finger on that. This is only one part. This will jumpstart weight loss. But unless you have that comprehensive program, communication, dietary, nutritional instruction, exercise, physiology, until you have all those together, you're not going to be successful. Linking those together through communication is critical. And we will be using such things as MyFitnessPal on a phone app and the Fitbit that you wear on your wrist to measure your exercise. They all feed back. We can monitor both caloric intake, weight, and exercise remotely, and then communicate with our patients 2 or 3 times a week. So it's an intense monitoring and communication, training the patients to be used to eating smaller amounts of food because they've got this thing in here and they can't eat a lot. And once they learn that, then we follow them closely after this is removed to monitor to be sure they are compliant with the small meal intake. It works.
It really sounds amazing. In order to have, do you have to have a dietitian? Are they in-house? Does somebody teach them when they come? How do you prepare the patient to get ready to have the balloon in there? What do they have to do before that? Are those all questions that you answer?
We talk to the patients ahead of time, and we educate them thoroughly about the balloon and some of the side effects with that, about the importance for communication. We have them discuss with and develop a relationship long-term with a dietitian.
And that's what we're going to be talking about when we come back. How do you prepare for this? What does it take to prepare? When do you see the nutritionist? When do you start the exercise program? What kind of guidance do you need? You and I can both lose 10, 20, 50 pounds. You'll want to stay tuned. We're talking with Dr. Gene Overholt, and we're talking about balloon therapy for weight loss. This balloon right here is filled with water. It starts off as a little object, and with endoscope goes down to the stomach, and then the water is inserted, it's filled up, and this is left in the stomach. It can't go through, it's too big. Can't come up, it's too big. Stays in the stomach so that when we eat food, we're full easy. Is that pretty much the gist of things?
That's an excellent summary.
And the important thing that you said was the comprehensive program of weight loss instruction, how to eat, what kind of foods to eat, and exercise that's remotely controlled to come to you at the office where you can say, now listen, you haven't been exercising enough. So tell me about, if a patient wants to lose this weight, how do you prepare them for the endoscope right off the bat? Who's a candidate?
Well, education is the most important thing, and the patient needs to understand that this is a long-term commitment between them and us. But the actual procedure is very simple to prepare for. All the patient has to do is have nothing by mouth for 10 hours. Then we can go down with the scope and insert this, inflate it, and pull the scope out, and it's over. It doesn't take very long to do it. Patient goes home the same day. They will feel something in their stomach.
How much does this weigh?
That weighs 1.3 pounds.
1.3 pounds, that doesn't seem like very much, but if it's pulling down with gravity, or when I lay down, it pushes up, I bet it'd be an unusual feeling.
It is. It's a feeling of a weight and a fullness in your stomach. Some people describe it as a weight, some people say discomfort. And it will be present for 3 to 5 days, and then they gradually get used to it.
Side effects?
Side effects are common. They are short term. They last 3 to 5 days. Almost everyone will have nausea, and almost 3/4 will vomit some degree. Some people call it mild, some people moderate, and an occasional person will say, this is so severe that I don't want to keep it, but that's rare.
So that would sound logical. There's something down in the stomach, it's full in there, the body says, hey, it's not supposed to be in there, let's barf it up. So nausea and vomiting. Any other problems handling foods, certain kind of foods?
Well, nausea, vomiting, and the discomfort. Those are the 3 common side effects. In terms of handling foods, you start with clear liquids, 3 days, full liquids, 3 days, 2 to 3 days, and then you move to soft foods. And by 2 weeks, you're probably into a regular diet, but it's portion controlled. That will not allow you to eat a full meal. You'll eat about 1/3, and then you'll be full.
And that's great. We all know when we sit down and eat and we have second helpings, oh, I wish I hadn't eaten so much. And we have that terrible full feeling like, you know, we ate too much food. So this is going to help us eat less food because the stomach will be full. Then how do we know what food to put down in our stomach? You say a liquid diet, then a soft diet, and then we're used to it. Then what happens? How do we know what kind of foods to eat?
The dietitian is very helpful in that regard because they will provide the instructions on a well-balanced, rounded meal, proper protein and fat and carbohydrate intake.
Does this keep people from feeling hungry during the day? Do you still get hungry?
No, most people do not get hungry. They have this fullness in their stomach and they don't get hungry. At mealtime, they'll eat, but it's not the kind of eating that they used to do.
If they overeat, what happens?
They'll vomit.
Okay, so it just won't go in there and,
That's right.
and comes back up. So exercise, when can you start exercise? Next day or a week later?
Weight loss is a combination of dietary restriction and food restriction, which the balloon will do, but you have to exercise. And we have an exercise physiologist who develops an individual program for you, and that program can start as soon as the patient feels like they want to. It's typically about 10 days after this before they'll start their exercise program. No exercise that they can do, no food they can eat will injure that balloon. So they can exercise, they can build to whatever they want to, marathon or whatever.
Somebody is morbidly obese. They have a BMI that's very high. And somebody that's just obese, they've got a BMI that's too big. Is there a difference in those two patients? Somebody that weighs 450 pounds or somebody that weighs 296 pounds?
There's a big difference. First off, the FDA and its regulations require that we limit this to use in patients with a BMI of 30 to 40. That is somebody who's about 100 pounds or less overweight. For the really large people that are a couple hundred pounds, the 350, 450 people, we work with them on an intense dietary exercise program, get their BMI down to where we can use this, and then we place the balloon.
I bet you that's a big day for somebody that's really obese, a tense program, and then they're able to use this to help them lose weight more rapidly?
Oh yes, more rapidly. They'll lose weight with that quickly.
So is there any, we call it the word invasiveness, surgery. So with this, I haven't seen any place where you've had to do any kind of surgery. Is that?
You don't do surgery. This is totally reversible. You put it down and you take it out with a scope, and there's no surgery. If there were a complication, the balloon could deflate maybe half or even all of it, and it would pass. If it passes, it almost always goes all the way through the GI tract, but there is a remote possibility it could hang up somewhere with an adhesion or in the anatomy
Sure.
of the small bowel. That, if that were to occur, it would be a blockage and would require surgery, but that's rare.
What about the poor person that's not 100 pounds overweight, but they're 56.4% pounds overweight? What can you not do that with them too? Because there they would be losing the weight, or do you have to follow strictly FDA or what?
No, we will. There is going to be a significant number of people who are 30 to 50 pounds overweight that need help, and they just can't get beyond that. And this will be ideal for those people. The mother of the bride who wants to lose 30 pounds for the wedding, or somebody who's got early onset diabetes who needs to lose 30 or 50 pounds to bring their sugar down to normal. Perfect.
Somebody that's got high blood pressure, somebody that's got sleep apnea, somebody that's can't exercise because they're too heavy. The list goes on and on and on about the people that need to lose weight in the United States, and this is a huge aid. If you can only leave it in 6 months and you take it out, how long before you can put it back in again?
24 hours.
Oh, so 20.
You can put it in right away.
Okay, so but you do have to take it out.
You have to take it out because the longer that balloon is left inside, the greater the risk of it deflating. So you take it out. If the patient begins to gain weight again, you put it back down. Obesity is a lifelong disease, and you have to treat it over a lifetime. And this will be significant help.
I just think that's what we say is cool. I think everybody needs that help sometimes, and here's something that we can provide. Dr. Jean, thank you so much for coming to the Dr. Bob Show. I'm very excited about the possibilities this has to improve the health and fitness of our United States.
Thank you.
Great information. You're going to want to stay tuned. We're going to be talking about Is my immune system working well? I get infections all the time. How do you evaluate it? And also Sjogren syndrome. Dry mouth, dry eyes, what can we do about it? A lot of information for you. Great show. I want to thank Dr. Gene Overholt. Wonderful discussion on balloon therapy for weight loss. Very, very interesting. Now for questions from you, the viewer, that I think will be important to your health. Question number 1. Dr. Bob, how do I know if my immune system is working? This is a question that everybody has. How can I help my immune system work better, or is it working good enough? Your immune system is what fights off foreign substances, bacteria, things that we breathe in that shouldn't be there. And the immune system will help attack those to get rid of them. The immune system works on other places. There's an immune surveillance where cancers have a specific protein on the end. That's their personality. The immune system can come and recognize an abnormal protein and can get rid of early cancers that we don't even know we've gotten. So how do you check the immune system? Well, first, you take a history. Are you having a lot of infections? Are there skin infections? Are there sinus infections? Are there infections of the eye? Do we have infections 5 or 6 times a year or a month that we have? If so, we have to check out the immune system. First thing we do is we measure immunoglobulins. Those are antibodies. There's an immunoglobulin G, let's call it IgG. That's the antibody that neutralizes most bacteria. That's the one that we want. If the IgG is low, we can replace that. The other immunoglobulins, we don't do a very good job of replacing. We can't replace them. There's IgA, immunoglobulin A. It sits on the lining of the mucosa and keeps viruses and bacteria from penetrating and getting into the body. There's IgM. It's the first antibody that we fight off infections. So the first time a baby sees Escherichia coli, then it's IgM. After that, it's IgG that comes over. So the immune system can be evaluated with blood work. Now, there are other parts of the immune system that we need to evaluate. Are we producing proper antibodies? Well, most of us have had a tetanus booster. If we've had a tetanus booster, we can measure tetanus antibodies. Or most of us have had our pneumonia shot. If you haven't, talked to your doctor about it. That will produce antibodies to strep pneumoniae, to 28 strains or to 13 strains. And so we can either measure those, or we can measure them, give you a pneumovax, and see what the response is. That's the way we check the immune system to see if it's working properly. Work that out with your doctor. If you're getting lots of infections, you need to find out why. Question number 2. Dr. Bob, what is Sjogren syndrome? Well, most people that have Sjogren syndrome know what it is. They just want to know what's going on. It's an autoimmune illness that goes against the tear glands, the lacrimal glands, and against the salivary glands. So the autoimmune system, we attack the salivary glands and the lacrimal glands. So we get dry eyes and we get a dry mouth. What can we do about that? Well, there are ways that we can put hard candy, we can put lemon drops, things that stimulate saliva. We can sip on water. We can make sure we breathe through our nose so our mouth doesn't get dry. There are some medications that we can use to help produce saliva. Same thing with the eyes. We can use replacement tears. There are medicines that will help us produce tears. Both of them are very significant problems. If you're not putting out enough saliva, you can get cavities, you can have problems with your oral hygiene. And if we're not putting out tears for the eyes, then we can get dry eyes and we can get cataracts. So know that Sjogren syndrome usually occurs with people that have either lupus or people that have rheumatoid arthritis. It's sort of part of another autoimmune illness that's attacking those two glands. It can be very, very bothersome. Nothing worse than a real dry mouth all the time, a cotton mouth all the time. But there are things that you can do, and you have to work that out with your doctor. That's all the time that we have for this show. I hope you've enjoyed it as much as I have. Remember that exercise is the most important thing you can do, and it simply means self-motivation. You've got to start exercising. Once you start, you'll feel lonely if you don't exercise every single day. Make it where you walk, where you swim, where you jog, where you ride a bicycle, but just make sure that you're getting out and doing something. It doesn't matter if it's raining, doesn't matter if it's cold. You can simply put on proper clothing. Get 8 hours of sleep. There's nothing more important than your 7.5 to 8 hours of sleep. If your brain is rested and your body is rested, you'll perform better. So know how to go to sleep. Know that pain or medications can keep you from going to sleep. If you wake up in the middle of the night and can't go back to sleep, you may have to talk to your doctor about medications. Alcohol sometimes makes people sleepy, but it reverses in the middle of the night and sometimes people wake up. So be careful with alcohol. Eat properly, eat good breakfast, but make it fruit and fiber. That'll help lower your cholesterol and help the heart. If you eat properly, and when you eat meat, make it where it's not fried food. And what most of all do we like in the Dr. Bob Show? Well, you got to giggle, got to laugh, got to have fun, got to enjoy yourself. When you're laughing, you'll be healthier, and so will everybody around you when they laugh.